हमारे आज के अतिथि वक्ताओं का बहुत बहुत स्वागत है। और इसी प्रक्रिया को आगे बढ़ाते हुए हम आदरणीय डॉक्टर योगेश पाटिल जी से निवेदन करेंगे कि वो अपनी प्रस्तुति देने का कष्ट करें। डॉक्टर योगेश पाटिल, नमस्कार।
नमस्ते सर जी। धन्वंतरि को प्रणाम करते हुए और जो भी आयुष समृद्धि के ऑल डिग्निटीज ऑन द पैनल और खास करके अग्निहोत्री जो बहुत अच्छी तरीके से सब चीजों को संभालते हैं, तो उनकी संभालती कमान को सामने लेते जाते हुए। और सर जी, मैं अभी थोड़ा आते वक्त कुछ दिन का सेमिनार भी पुणे के ट्रेन से दिया था, अभी पुणे में ही हूँ। कल निकल रहा हूँ, तो अभी एक प्रोग्राम
मुझे
में
पता
खाना
नहीं
हो
आप
के अभी
जी, मुझे पता नहीं आप अकोला कॉलेज में तब थे या नहीं, जो हम लोग वहां पे एक बार
हाँ, नहीं नहीं, सही है सही है। तो
जी
अंदर आपको डिलीवर कर रहा हूँ। तो बड़े एक शॉर्ट और स्वीट तरीके से मैं आपको टेलीमेडिसिन का थोड़ा एक डिफरेंट एंगल समझाना चाहूंगा। तो पवन जी, सर जी, नमस्ते। और इसमें मैं अपनी आज एक दोपहर में बैठ के पीपीटी का जो इम्पोर्टेंट शेयरिंग करता हूँ, इससे थोड़ा सा समझने में आसानी हो जाएगी सबको। So the today's topic is understanding the medical legal of telemedicine in India, right? So we'll talk about India today. So myself, Yogesh Patil, will introduce you what is the status of telemedicine in India. Like telemedicine has brought a new dimension to healthcare, but its medical legal aspect still is ambiguous in India because there is no as such clear-cut law. There are regulations, but there is no law. So, just for the information, father of telemedicine in India is great Sir K. Ganpati ji. I just mention it because we should know the originator of this. So, what is telemedicine then? So, World Health Organization defines the telemedicine as the delivery of healthcare services using information and communication technologies. Very simple and clear. And that is the new era also. Everything has been intervened by technologies nowadays. And now, what are the types of telemedicines? If you'll consider telemedicine, there are three types like store and forward, remote monitoring, and real-time interactive services. But very important thing we should understand is like what is the difference between telemedicine and teleconsultation. So we should understanding where today's topics is telemedicine, but we should like differentiate the line of demarcation between telemedicine and teleconsultation. Like telemedicine involves, like it's called as telehealth also. So telehealth involves both clinical and non-clinical services. Like telehealth provides a broader scope of medical services, and teleconsultations refers to only clinical services. Like our doctors are doing all the clinical things. So the difference between teleconsultation and telemedicine is non-clinical, and here is clinical. So who regulates the telemedicine in India then? On August 2023, the National Medical Commission, everybody knows the NMC now, has released the National Medical Commissioner Register Medical Practitioners Professional Conducts Regulation 23 to regulate the professional conduct of registered medical practitioner. Like I just before said, there is a regulation rather than a law. So these are the regulations made by NMC, and it's recent one. So is doctor consultation legal in India? Any registered medical practitioner enroll in their state medical register or in the Indian medical register is permitted to provide the telemedicine consultation. No special qualification are required at present. Under this Indian Medical Council Act, it was in 1956. So it's, you can say it's legal in India, right? So what are the benefits of telemedicine then? Like, see, telemedicine has changed a lot of things and it will again in future. I will talk about the future also. So increase access to care. Number one, very important. Lower overall cost. Like suppose I'm in Pune, I'm in the Pimpri Chinchwad, and I have to consult somebody which is very 50 kilometers away. So automatically the cost is means lower, or even outside also if you are consulting. So lower overall cost, high patient satisfaction rate. Because in Corona, we had gone through all these processes, how important it is, and we quote that every patient doesn't require human touch or clinical examinations, and all the patients are get cured, right? So, what is the legal framework? No specific law in India for telemedicine at this moment. Telemedicine practice guidelines provides a framework. Of course, these guidelines and these regulations are as considered as to be law. Guidelines are legally binding, though not laws, right? So we should understand this concept. What are the key feature of guidelines? Registered medical practitioner can practice telemedicine. No special qualification required for now, as of now. Identification of RMP and patient is required. See, identification of RMP, registered medical practitioner, and patient is required. So last time I also said regarding this key, a relationship of the patient, it may be audio, visual, whatever it may be, it should be established. That is what the law expects, right? And the person who is treating should be a registered medical practitioner, so that there should be not any quack, whatever he is telling. So consent implied or explicit. See, implied means what? Suppose in your clinical practice, somebody is giving injection physically, when the doctor is giving injection, and the patient turns and he just by his body language from the eyes, you prick it on my hip. So without talking on the body language, he has given you the consent, prick here, right? And doctor also prick there. So it's called as implied. And suggestions, suggesting. Consent is implied when somebody is talking with you on audio, video, or teleconsultation. That means his consent is there, right? Or even in the mail form or whatever it may be. So prescribe medicines with professional responsibility. These are also very important thing. Responsibility is always required as a professional. Then ethics and confidentiality apply, because when you are in the healthcare, there is always should be confidential should be maintained, like there, because it comes from the documentation. Documentation has been handled by your assistants and all the electronic peoples, right? So misconduct penalties always apply. So that I will talk later, which kind of legal bindings are also there. And documentation and fees apply. So documentation and fees is always applied, because you are entitled to take the fees. So guidelines for telelocation by NMC. I make it very short, like guidelines from NMC mandates the doctor to issue an e-prescription for the teleconsultation. The e-prescription should contain the doctor's name, qualification, registration number, address, and other contact details. It should also include the patient name, age, sex, and contact details. So when you are e-prescription, these are at the clinical level also, into physical also, this has been maintained. Ethical issues of teleconsultation. See, insufficient clinical information transferred to the opposite side. This is one ethical issue. Broken communication between doctor and patient, like I am talking with you, their internet connection problem is there, something like that. Inaccurate and unclear reporting can be there, because I am seeing here and there and talking with you. So such things can happen. Security of personal healthcare information maintained in electronic form by the peoples, right? So again, there is a security issue is always there. The reliability and risk of housing. So these are some ethical issues. There are a number of things that are there. Downside of the telemedicines, like inequitable access. People without reliable internet or wireless connections cannot participate in telehealth. But nowadays that issue has been gone. Everybody has nowadays net and mobile, everything. That's why the future is very great. Inability of doctors to collect a patient's vitals. This is one issue. If a patient lives in the area with poor internet coverage, they may not be able to access the telemedicine services. But nowadays, that is not the issue. So, India's free telemedicine services. I just mentioned for the knowledge this here, e-Sanjeevan OPD, that caters all both rural and urban areas. It's a government services, all these things are. Just for the information, I just made it. It has trained and onboarded like 222,000 near about doctors and health workers. So medical issues of telemedicine. See, in a short, I made it all this like registration, licensing is always required. Insurance is also implemented or intervened by it. Then quality issue is always important in the medical legal issues. Privacy, again, it will come if you'll think of telemedicine. Confidentiality issue is always there. Other risks associated with electronic healthcare communication, right? So future of telemedicine in India, it improves reach of healthcare facility. Since telemedicine can connect healthcare professional to patient in different zip codes, like everywhere you can reach, everywhere you can reach even in abroad or anywhere. So they can treat patients in remote areas. They can also address this patient with no past affiliation with hospitals, right? So now see, very short, I am just mentioning what are the precedents in courts. Like there are two cases I mentioned, ki Deepa Sanjeev Pavaskar case. Doctor held negligent for prescribing medicines without proper diagnosis. And in the Sushant Rajput case, prescription of clonazepam through teleconsultation deemed illegal. What it reflects or what it means is when you are in telemedicines, you are legally binded. You are having the legal entity. eh, like anybody can sue you. It doesn't that you are not prescribed and you are not so your liability and responsibility, legal liability is always there. So in conclusion, I will say the legal framework for telemedicine in India is evolving, and surely it is very great. Everybody should think about telemedicine in future because again the AI will be there, and even on the telemedicines you can touch your mobile and their patient will feel that you touch his abdomen. That is going to come in the robotic technology. So always the future is very great, and guidelines need to be become more robust and very clear as the television uses increases. So very short demonstration, sir, because I had to travel again 1 hour from here to my original place. So I made it very short. And thank you very much to all the dignitaries who has given me the chance to deliver this very uh, small lecture on the big topic. I conclude with this. So I hand over to Agnihotri sir for the
Thank you so much, and
exposition.
definitely I appreciate your zeal and your commitment that you have to go for 1 hour long journey. It is already 11 o'clock, so it will be midnight when you
It's
reach
a
your place.
journey only in the Pune itself because now the metros are being so much increased now. So I had to drive the car also from here. That's
Oh,
why I
now
came in
you
the
are in
room and
Pune.
then yeah,
At
yeah,
present
yeah.
you are
I'm
in
in the
Pune.
Pune now.
Okay.
Yeah,
Okay.
yeah, yeah. Right.
Dr. Shripad Mahamuni is also there in Pune. I think he
Okay,
also.
okay, okay.
So I think
Uh-huh.
Dr. Ayanda ji has not joined yet. So I would like to invite Professor Pawan Kumar Sharma ji, because when he will start, he will cover all the legal points also, which has been well raised by you,
Yeah, surely.
and
But
also
sir, yeah, 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 yeah. Okay. So with your permission, should I leave the meeting
very
and you
very
can proceed
natural.
with all this? Yeah.
Yes, yes.
Right, sir.
You
Right,
can
sir. Huh? Thank.
you can keep in contact
Yeah,
with
in the
in your
car
car
I will
also.
continue the Zoom. No issue.
Definitely.
I will
Oh,
listen
oh.
this. Huh? My video will not be there, right?
If
Okay.
you will be there
Yeah.
in Pune, I would like to meet you as and when I will be there. My daughter is there.
Yeah,
Okay.
yeah, surely. No, I'm not from Pune. I'm from Akola. I just came with my mother to here for one program. So,
Okay, okay. No problem.
yeah, yeah, yeah. Sure. Thank you, sir. Thank you very much. Right. Yeah, yeah,
Safe journey, safe.
yeah, yeah.
So I invite Professor Pankaj Sharma for his presentation of the topic telemedicines and guidelines. Namaskar.
Thank you very much, sir. Today I am not going to present my presentation as time has already been crossed our limits. But 4 or 5 important points. Telemedicine guidelines have been issued for AYUSH also. As per the system of NCM, the guidelines have been issued during that COVID period only. There are 3 types of telemedicine. Number 1, our patient once visited our clinic, we are acquainted with him, and then he is revisiting us through technology. Number one. That is moreover on safe side. Second one, the patient we have not seen physically, but virtually we are prescribing medicine without touching him. No darshan, only virtual uh, virtual darshan and prashna only, no spars. This type of patients, two medias are there. Number one, telemedicine softwares like Practo, like other doctor sites who are utilizing these softwares and facilitating their customers to conduct telemedicine directly with the customers. And fourth one is direct telemedicine guidelines. So only three important points. Number one, please take care of your identity. Now Government of India has been circulated and considered mandatory to register yourself. If you are a doctor, register yourself in HPR, Health Professional Registry, and take your ID from HPR by submitting online submission, by submitting your degree, your certificate, and your Aadhaar card. Number one. ABHA ID. This is also the initiative, excellent initiative for the data recording by government for patient, for each and every citizen of India. No consideration of class. Everybody has to make their ABHA ID. So ABHA ID can be quoted, can be cited, can be referred in each and every treatment guidelines. When patient will enter into the hospital, he or she has to show the ID. That ID number, if ID number is noted, please believe all your medical findings, records, everything will be available on your app. So this is excellent initiative by the government and we should welcome it. So until and unless you are dealing with ABHA ID, please make sure that you have noted patient's phone number, patient's email ID, patient's communication and patient sign, etc. Because so many hackers are also there in each and every phase. So we don't know whether hackers will affect that or not, but you have to be careful by the hackers and be careful for your now reaction. Generally, a patient is in agreement with doctor that I have full confidence on you and you are my guardian to treat this disease, particularly for a specific project. But in this, if any reaction is there, adverse reaction, SCR, if any is there, please believe whole credit, discredit will go to the doctor. So be careful again by prescribing medicines with poison, Schedule A as Schedule E. Definitely those medicines should be prescribed carefully when we are directly there in that city. So thank you very much, Agnihotri sir. We are really fortunate that today Varnekar Mahesh Sahib is at present already there.
Thank you, sir. Thank you for your brief and to the point presentation, and also this presentation containing so many very, very important and essential information regarding the extending your services as a physician or surgeon online or as a telemedicine part. But physically when a person visits the hospital, as you told that for that AVA ID is very important, and one physician is supposed to be registered under the HPR, so that he will be having the registered number and also having the qualified doctors list placed in that list, and he will be little bit confident enough and safe also to proceed further. But as far as the telemedicine is concerned, the very, very important guidelines laid by the government of India, that too during the COVID-19, is strictly followed, or otherwise there may be any crisis to any of the attending physician, and it's quite safe to be there from outside and guide them. And every such a step has got its limitations, so one has to be careful at the time of expanding these things. What I think that with us, our Dr. Mahesh Parlikar sir is very much with us, and as he started as an inaugurator person of our first webinar, I would like to have the blessings at the closing of our today's webinars group of three webinars topic. So it will be our pleasure if he is here and will like to say some words for the enhancement and encouragement of our all the guest speakers of our all the three uh, webinars. So I invite Dr. Mahesh ji, please say a few words for as a greetings and ashirwad and remarks of our today's efforts making the webinar. Namaskar.
Thank you, sir.
Namaskar.
I'm highly obliged, sir, and highly inspired at the age factor, considering both of you and the rest of the speaker at so late night you are working for the benefit and the future of the Ayurveda. I must really obey to you people, and I would like to have a blessing from you to have such a wonderful energy to work for the betterment of Ayurveda at this age. I am comparatively, I am very, young enough. I am very lucky enough to join this meeting and hearing your experience word. So I am very, very inspired and very happy and very lucky enough to join this webinar sir, today. So it was a wonderful, and the topic have chosen are very real time related topics, because many of us doing the teleconsultation but they don't know what is the basic legal aspect of this topic. So uh, the such topics need to be mobilized, channelized, and should reach to the young generation at this time, so they should know what are the legal aspect of this telemedicines and how they can improve, so that maximum benefit of Ayurveda medicines or Ayush medicines can be reached to the rural, urban and rural area at par with the modern medicines. Our target should be so that we should have that parity with the modern medicines, so that more and more people will accept our science in large. The great effort you people are doing, sir. I hats off to you. Thank you so much for giving me this opportunity. I'm really once again highly obliged, and thank you so much. Very much inspired. Good night, sir.
केवल आधा मिनट की सूचना दे दूं, हम डॉक्टर राकेश शर्मा जी के साथ एचपीआर के लिए वेबिनार करने जा रहे हैं।
Great,
डॉक्टर
sir.
बीएस प्रसाद जी के साथ एनसीआईएसएम, डॉक्टर बीएस प्रसाद जी के साथ हम लोग वेबिनार करने जा रहे हैं ऑन सिलेबस ऑफ आयुर्वेदिक बीएमएस, यूजी एंड पीजी। अच्छा, तीसरी डॉक्टर अहिल्या शर्मा, वाइस चांसलर ऑफ कर्नाटक संस्कृत यूनिवर्सिटी, उनके साथ हम लोग एक सीरीज संस्कृत पे शुरू
Great,
करने
great,
जा
sir.
रहे हैं।
Great.
तो बस लगे हुए हैं, आशीर्वाद दीजिए और जुड़ते
Yes.
रहिए, मंच को जुड़ते रहिए।
Please, please, sir. Anytime. Thank you so much, sir.
बहुत अच्छा आपने कहा, और एज तो कोई मायने नहीं रखती, एज इज नो फैक्टर। अगर इस एज में हमें ये इंतजाम है कि हम कुछ करके जाएं और नई
Correct,
पीढ़ी
sir.
के लिए मार्गदर्शन बने, तो हम एज नहीं बढ़ा रहे हैं, हम अनुभव बढ़ा रहे हैं और उस अनुभव
Correct.
को बांट रहे हैं। और आप जैसे लोग मिल जाते हैं राह में चलते हुए तो फिर और खुशी बढ़ जाती है। एक
थैंक
नया
यू
उत्साह
सर।
हो जाता है कि अगला मॉर्निंग और अच्छा जाए, इस भावना
यस
के साथ
सर।
काम कर रहे हैं। और आप जैसे लोग जुड़े, आप इतनी दूर गोवा में हमारे आयुर्वेद के लिए काम कर रहे हैं, हमारे लिए बड़ी प्लेजर की बात हुई। तो
थैंक यू
इसलिए
सर।
हम
थैंक
नवीन जी का भी धन्यवाद करते हैं। और आपसे तो आशाएं बढ़ गई हैं कि आप हमारे विभिन्न टॉपिक्स पे जुड़ते रहेंगे। अभी तो मई
जरूर
की
जरूर
बची
सर।
है, फिर आपको जून को भी हम कम्युनिकेट कर देंगे पूरा
प्लीज
शेड्यूल।
सर, प्लीज
आप
प्लीज।
जी अपनी चॉइस से आप और अपने साथी जो भी इंटरेस्टेड उनको जोड़िएगा। और
जरूर
गोवा
जरूर।
में भी हमारा आयुर्वेदिक कॉलेज भी है, तो
हाँ सर।
निश्चित रूप से जी, और लोग जुड़ेंगे। और कोंकण प्रदेश में तो साइड में बहुत अच्छी हर्ब्स भी हैं, बहुत अच्छे सहयोग है।
यस यस सर।
बहुत
वेस्टर्न प्रो
बहुत बहुत
वेस्ट।
धन्यवाद सभी का, आज के सभी गेस्ट स्पीकर्स का। सबको नमस्कार, शुभ रात्रि,
थैंक यू सर।
गुड नाइट।
शुभ रात्रि, शुभ रात्रि
सर।
जी, गुड नाइट, गुड नाइट।